You've worked with thousands of hygienists over the years,
I have.
and I'm sure a lot of dentists. So what are the biggest mistakes that you think dentists are making in regard to running their hygiene team as a profit center?
Yeah, the first thing I think that dentists are making a mistake is they don't understand the opportunity. For example, I had a dentist call me this last week where he was spending more money employing a dental hygienist than that hygienist was bringing to the practice. And he just discovered this after 5 years. So I think the matter of recognizing what your hygienists are bringing to the table from a profitability standpoint is really important. The second thing that I think happens is dental hygienists come out of school and we're very technically knowledgeable about how to care for patients. The part that we don't understand is how to present treatment. What do we do when a patient says no? What if they have insurance and they don't want to pay for anything beyond what insurance pays for?
Because they are not salespeople.
Absolutely.
And I guess they don't want to feel like salespeople.
Exactly.
As well.
So typically what a hygienist will do will clam up and they'll do the pro fee for the patient, even if that's not what the patient needs. So in other words, Randy, they're giving away procedures for free. They're doing periodontal care, for example, but they're only charging a pro fee.
Okay.
Because they don't want to deal with that conflict.
So that's the number one mistake the doctors are making, is they're allowing their hygiene team to do free work.
Absolutely.
And the hygiene team, and I just want to make sure I understand this correctly because it's hard for me to believe, is it because they think they're doing the right thing for the patient?
They do.
Because they're there to keep them healthy.
Absolutely.
Right?
And that's what we learned in school, to keep our patients healthy. So understanding all the aspects that come with working in a dental practice is something that we don't learn in school. So what we do is we come in and we help them train their dental hygienists to be better partners in the practice to them, helping them to understand the business side of dentistry, how to present treatment, how to deal with common obstacles, and just how to be a better presenter when it comes to patient treatment to the patient.
What about the response with the hygienists across the country when you work with them?
You know,
Do they feel like they're selling something? Are they resistant at first and they're won over by, after it's all over?
Right. You know, I think when they first hear a consultant is coming in, they start to think, oh goodness, I don't know that I'm going to like this. But once they start working with us, they realize that there's a huge opportunity ahead of them to expand on what they know, what they learned in school, and to be a better hygienist. And I would say in the end, when we walk out, they're happy and they're motivated, and that's what we want.
And the hygiene department makes more money.
Absolutely.
And then each hygienist ends up making more money, getting paid for what they're supposed to do.
Absolutely. You're tapping into...
Is that right, though?
Yeah, because I am a big believer in paying your hygienists on their performance. So I believe that you should pay your hygienist just like you would pay an associate dentist that came into your practice.
Is that mistake number 2 by any chance?
That is mistake number 2.
So the biggest mistake that you see dentists make, they're not paying their hygienists what? On some sort of a commission program? What's the lingo in the industry?
I like to say pay for performance. I don't like the word commission.
Okay.
And I know a lot of hygienists do not like the word commission. So I'd say pay for performance. I believe that you should pay your hygienist for what they bring to the practice, just like you would a partner dentist or associate dentist coming into the practice. We're all providing procedures to the patients and care to the patient. Let's compensate everybody the same. That can make a huge change in a practice as soon as you do that.
Then what is the argument, though, that a dentist would have with this? Why would they not want to do it this way? Like, what do you hear? What do they tell you?
They're fearful of what their hygienists are saying. That is the biggest thing. Hygienists, we came out of school getting paid a per hour, and we're just used to that. And so basically, it's kind of a paradigm shift in the way that we're compensating hygienists. And dentists fear telling their hygienists that we're going to change the way that they're paid. And the hygienist may say they're trying to get us to sell more, when that's not really what it is.
Over the years, and for people just who haven't seen this entire interview, just saw a clip of it, that you used to run over 1,000 hygienists at one time.
That's right.
I mean, you saw those people. Is it true, and tell me, because I think you told me this on the phone, that once they get on this program, a pay plan that's paid for performance, they never want to get paid any other way?
That's exactly right.
Is that right?
That is right. Absolutely. I have hundreds of hygienists that are on this plan that would say, Heidi, I would never go back to a per hour pay. I love it this way. I get compensated for what I bring to the practice. How could it be any more fair? And
would you say that the most successful practices in America are on this pay for performance plan?
Absolutely.
Because I interview dentists all the time too. And since we talked, I think probably a couple of months ago, I've been asking, in Montana, they're a $15 million a year practice. And I always think if they're exaggerating, maybe it's only a $9 million a year practice, right?
Yeah,
That's pretty
right.
big. They go, of course, yeah, we would never do it any other way. So the hygiene team makes more, they do better. And actually, ultimately, and this is the part I couldn't wrap my mind around, is that the patients get better service and the patients get better care.
They do.
Right? Could you elaborate on that?
They do. Well, think of it this way, Randy. They're not giving away those procedures for free, the hygienists anymore. And if they're not giving them for free, that means they're educating the patient about what's going on in their mouth, as they should have been doing before. And so the patient is more aware. And I would say that the patients are getting more comprehensive care across the board.
Okay, is there a third mistake that we haven't talked about that maybe frustrates you or drives you nuts that is going on out there that they're making as far as mistakes?
Absolutely. I believe, again, that we have to focus on dental hygiene, and I know this is part of my 3 mistakes anyway, but you have to focus on what's happening in the hygiene team in your practice, and you have to put effort into training and developing them. For example, I want to throw out a statistic to you. 75% of the doctor's revenue should be coming from the hygiene chair.
Interesting.
So in most practices, that's not the case. So if you spent more time developing your dental hygiene team to understand your philosophy of treatment and how to present treatment, your revenue would increase as well. So it's taking some focus off of the doctor and the revenue that they're producing and placing your focus on hygiene. Hygiene should be producing 30% of your total practice revenue. And in most practices that I walk into, that is not the case.
So when I speak to a guy in LA yesterday, and he's a client of mine, he goes, Randy, I'm not one of these doctors, and he goes, that's about hygienists. You know, I want to make my money in my professional fees.
Yeah.
What do you say to a doctor like that?
You're missing an opportunity. Your hygienist can bring 30% of your total practice revenue. So we don't depend so much on you, doctor, to be producing such a heavy load to pay for all the overhead of the practice.
So you could still make your money with professional
Absolutely.
fees, but you could now also make money with your hygiene team.
Your hygienist should be a profitable center in your practice. You should be getting a 30% profit from your hygiene team on a regular basis, and that's something that I guarantee to my clients.
So once you've identified these problems within the practice, what do you do about it then?
When I go in with my 12-week program, we start by implementing the protocols and systems necessary for them to be profitable. That includes scheduling, that includes communication, how we're going to treat the patient. We also will bring in the compensation structure that will help you be profitable. Okay. And that is really, you know, the bow on the package that really helps you bring that high level of profitability to your practice.
And so you help them with the pay plan. You
Absolutely.
Tell them, I mean, you have forms and the paperwork.
I have the paperwork, we'll model it out for them, we'll make sure that it's a fit, and I'll help them implement it into the practice, because one of the hardest things to do with a pay plan is to actually implement it, because there's a lot of questions that come into play with that.
What about standards and protocols and expectations? Do you get involved in that part of it too?
I do. And you know, there's a lot of consultants out there that have brought in these really cumbersome protocols and structures that don't last. You know, they walk out the door after 60 days and it kind of falls apart. I'm a big believer in keeping things simple. So I bring in systems and protocols that really can stand through the years, that will bring you great care to your patients, that people can implement right away and can stick to. So when I walk out the door after 12 weeks, you're going to continue that growth.
You say that doctors don't even know when there's 2 hygienists, 4 hygienists, 6 hygienists, they don't separate the production.
They don't.
Is that right?
That is right.
Is it that common?
It is common. I have it with most clients.
And why is it so important to do that?
Well, I think you'd like to know how each hygienist is performing, because you may have 2 hygienists in your practice doing totally different things. I have a client right now where one hygienist is producing over $800 a day more than the other hygienist. How does that happen?
You tell me.
Exactly. One of the hygienists is not providing comprehensive care to their patient. They're talking more about themselves and not about the needs of their patient. So that's a hygienist that needs training, needs direction, and needs some accountability in order to improve better.
And so do you find that when you measure and put numbers on monthly totals of what they're bringing into the practice, that the people that are at the bottom start moving up?
Absolutely. You know, that little level of competition that can come into the practice, some people are fearful of that, but I think there's such power behind that. And really seeing from a tangible standpoint how well you're performing. Some hygienists never see that. They have no idea. I'm a good hygienist. Well, how do you know you're a good hygienist? And the first time that they see
Very
it
interesting.
is when it's on paper. So one of the things that I like to do when I start working with a new client is figure out the break-even point for hygiene, what they should be producing. Most dentists don't know what their hygienists should be producing. So they may say they're producing $1,300 a day, but not even know if that's good. So I will help them understand what their break-even point, where they're paying their hygienist, paying the overhead, and getting a 30% profit.
And they don't know that. Is
They
that
don't
right?
know that. So I will lay out that goal for them, and that really gives you a baseline to understand how well is your current team performing based on these standards for your office.
So how do they normally do it? They look at, okay, because I talked to a guy after I talked to you, and I said, how's your hygiene department doing? This is after I talked to
Yeah.
you, right? So I'm kind of excited to hear what he has to say. He goes, oh, excellent. I go, based on what? He goes, well, we're up about like 40,000 from last year.
Right.
But you don't like that. Elaborate why. Why that's not enough. Tell me why that's not enough.
It's not
'Cause
enough.
He's making more.
Absolutely, because I think every dentist tracks what they're doing day to day, month to month, and they should be doing the same thing for the hygiene team. Don't be looking year after year. Yeah, year after year growth is great, but what are you going to do about it? If you're tracking day by day and even forecasting what is coming ahead in their schedules and what could be coming ahead for revenue, you can make growth changes in your practice right away. So not wait until the end of the year to understand if you had growth. Why not intercept it right now and plan for growth and make that growth happen?
You know, I know with managing salespeople over the years that if you, for example, let's say the hygienist is bringing in 2,000 a day.
Right.
And she does, 2,000, averages maybe 1,600 a day. And all of a sudden, if she's down to 700 a day, with the right kind of measurement, you can say, well, what's going on?
Exactly.
What's happening here? And also, what happens, and I know with salespeople, when you start keeping track of numbers, progress, it improves. When it's
Exactly.
measured, it's improved.
And I'm a big believer in that. That's why I have trackers in place so the hygienist can see how well they perform every single day, because that can often, change the way their behavior is or what they're doing in order to be successful. So I agree with you. If you look at numbers and you look at progress, it will increase.
And I'm I face people all the time that they don't want to be salespeople, doctors. I'm not a salesperson. I'm not like this guy or that guy. But it is about positive influence.
It is.
And you could teach these people to become more effective.
Absolutely.
So that's what you do. You make them more effective.
Absolutely. I'm a huge patient advocate. I mean, that is where my heart is. I went into dental hygiene because I love caring for people. That's me.
Okay.
And I truly believe when you provide the best to your patients, the revenue will always be there.
Okay.
It always will be there. And I think we all believe that. But let's take the measurements and the trackers and understand the whole business side of hygiene so that we can go there. And we do hold our team accountable because you have to understand the whole side of it.
With every one of your clients, do you pay for yourself? With the increase in production?
Absolutely.
Really?
Yes.
As of today's date, every single person gets a return on their money with you.
Absolutely. I'm thinking
Well, good
through
for
my
you.
people, and absolutely.
Does anybody make double their money back? 10 to 1 of their money back? Because, I mean, like any business, I'll put you on the spot.
Yeah.
But the goal is to kind of set them off and free. I mean, once you teach them how to do it,
Yeah.
and it becomes the culture of the way they do business,
Yeah.
but along the way, they can make money on you.
Right. Well,
along
Randy,
the way.
I worked with a client in May, and they have since quadrupled what they paid me. I mean, so they paid for it over and over and over and over again, and they will continue to. That's not a problem.